thank you, and thank you, Minister. I suppose, like many deputies, Minister, the cancellation of the healthcare workers scheme is regrettable. And I've spoken to many providers about this, of course, apart from the fact that it's a huge inconvenience for the healthcare workers themselves. But I get a sense, Minister, and I don't like to say this, but there has been a certain erosion of, I think, trust between the providers and the department, and it's really around the issue of consultation. People have said to me, this 17-page document arrived, it was a fait accompli, and we just didn't know what to do. And because of that, there's real concern within the sector. I mean, one of the issues is lots of healthcare workers work part-time, not full-time, so they couldn't provide the service. But I was interested in something you said a moment ago. You talked about childminders, because one of the issues that was raised with me is that the workers in this sector see themselves as education providers and not childminders. So I'd like if you might address this. But I do take on board, you've set up your advisory group, and I acknowledge that a lot of good work is being done there. But I still think that that trust needs to be rebuilt. Now, my question to you is about childcare providers signing up to the official contract to provide staff wages and, for sole traders, the €300 per week payment. My information is that many providers, especially the smaller ones, have not signed up because initially it was really a blank contract. So do you have any numbers as to how many have signed up to this and how many have not? And finally, while the €300, I'm being told, will tide sole traders over, and people are grateful for it, there are huge extra costs around reopening. And have you any plans in place to help to support providers when they reopen? And the pod system you referred to, will that mean that the number of children who will be cared for will have to be reduced? And if so, who will bear the cost? Thanks, Minister.
Thank you, Deputy Harkin. Minister.
Okay, thank you. I accept the issue around trust that you have identified, indeed, exactly. And so we are working hard to rebuild trust. In terms of your question around the sign up, is that for the temporary wage subsidy scheme that you're speaking about? At present, we have 84% of the providers that have signed up to that. And it's still, it's still there. It's still open for people to sign up, and some people have different reasons for not doing that. But that's a really, really high number, which I think, to me, demonstrates the success of it and meeting the needs. Even though it's not necessarily all of what they had originally, it's a significant, I suppose, support to the sector, which is largely better than most any other sector. In terms of the question around support, financial as well as guidelines for the reopening, we're aware of that, and factoring that in. No decisions have been made in terms of what that actually means. We have to first assess, well, what would be the costs to centres, et cetera, but certainly aware of the fact that they would require financial support, that there are going to be some costs in terms of the reopening in that regard. Those are your. Sorry.
I asked you about the pods. If you're going to move to that model, will that reduce the number of children that can be cared for?
Okay, thank you. Exactly. That there will be it's a phased reopening, and we are in a pandemic. So for both of those reasons, there will be a there will be a reduction in the numbers, and certainly initially, but there will be a reduction in numbers that are cared for in the centres, and so these are some of the real struggles and challenges right now in terms of how to prioritize, especially in terms of the initial reopening, and as we continue to grow, to find ways to meet the demand, and not at present not being fully aware, will there be the same demand even in the beginning, for example, as there was before the pandemic, which is why we've constructed and will be administering a survey of parents on one hand and the providers on the other, to try to get some evidence to help us with those decisions.